Шановні колеги, ми продовжуємо роботу.
Dear colleagues, we continue our working day, and the topic of this briefing is the fifth medical mission of Canadian doctors. Our guests are Chrystyna Waller, Director of Humanitarian Initiatives of Canadian Ukrainian Foundation, Igor Fedirko, Head of the maxillofacial surgery clinics, and Colonel of Medical Services. The floor is yours. Good afternoon. My name is Chrystyna Waller. I am Director of Humanitarian Initiatives of Canadian Ukrainian Foundation. Today we come together to announce the fifth mission of Canadian doctors, which would be from 24th February till 4th of March. Canadian surgeons and nurses will arrive to Kiev, and they will deliver master classes and provide surgery to ATO injured soldiers. Good afternoon, Ukraine. Good afternoon, Canada, who is listening now to us. I would like to greet Chrystyna Waller and Canadian Party. Miss Chrystyna Waller now announces today the fifth medical mission, which would be helping Ukrainian injured soldiers. We have injured soldiers who needs surgical operations, in particular facial and cranial, and also on extremities. And the Canadian Party has been helping us. Previous missions were very successful. They were announced 1 month in advance. Like this time we announced this mission. It will start on February 26th and will end on March 5th. And we announce for Ukrainians who know those injured soldiers, please tell them this information so that they have time to come to our clinics. First 2 days our clinics will be selecting the persons for surgical operations in maxillofacial clinics, and we will select those persons who really need operational surgery. Such operations not always are timely. Maybe some persons, some injured persons, they may have the period in which they cannot be surgical operators. So we received X-ray diagnostic equipment, which we have been waiting for a long time. We needed it very much, and we also were provided video telecommunications equipment, which will provide us communication in real-time mode with Antonisha, the doctor from Canada. This project was the idea of this project was generated 2.5 years ago, and during this time we became better qualified. We have already provided health care to very many patients, and those patients who were operated during previous 2 missions, we now announce that they can come so that we check the status of their health and whether they need further surgery. On behalf of the management of our department, I would like to thank the Canadian diaspora for having collected the funds. As you know, the Canadian community sponsored the first two missions. The third and the fourth missions were funded by Canadian government. This fifth mission is also funded by private donations from Ukrainian Canadian diaspora and thank you very much, Chrystyna Waller and Canadian community and Justin Trudeau and the Canadian ambassador Roman Vashuk, the ambassador to Canada, Roman Vashuk, and the team working in Ukraine today. Thank you very much. Thank you. In general, during previous four missions, we consulted more than 300 individuals and the surgical operations, 244 surgical operations in 137 patients were performed. The operation was very successful and we are very thankful to our colleagues from Ukraine, to Mr. Fedirko, to his team, to General Kazmirchuk, General Verba, and the Ministry of Defense of Ukraine who cooperated with us and hosted us, and the NGO Patriots of Ukraine and other patriotic organizations. They also support us here in Ukraine. We have been cooperating with them, and now we announce that we are searching for patients for the next mission. As Mr. Fedirko said, we are searching for maxillofacial patients and higher extremities injuries patients. Our telephone number you can see on the website. Thank you, dear colleagues. We have several questions. On February 24th, yes, you start. Yes, consultations will start on February 24th. How many doctors will be from Canada and how many will be from Ukraine? 25 persons will arrive from Canada, including 10 surgeons. This time I would like also to announce that American doctors will also cooperate with us. Those from US Army, they will be with us this time on this mission. How many persons who need surgery could be processed this time? We will provide consultations to 60 or 70 persons every time. We perform about 40 patients, so we shortlist 40 patients out of 60 or 70. Are there any more questions? I have comment as to Ukrainian doctors. The doctors of our maxillofacial surgery of Kiev main military clinical hospital of the Ministry of Defense of Ukraine, and also regional hospitals such as Odessa, Lviv, Kharkiv. They also take part in activities of this mission. Thank you, dear friends. At the end of the briefing, we wish you every success in your